Way. Well, hi everybody. Thanks so much for being here. It's so exciting to have our community growing from such a small group when I first started. I'm going to try to stick to my notes because it is a short time that I'm allotted and I have so much to cover, and if I start telling stories, I won't get through it all. So one of the things that James wanted us to talk about tonight was the notion both that chronic disease is reversible, and if we can uncover and correct the root causes, that we can reverse illness. So I'd like to tell you a little bit about my personal journey with chronic disease and how I came to learn functional medicine. And then I'll tell you a little bit about how I apply functional medicine in the treatment of psychiatric disorders and also now with neurodegenerative disorders like dementia. So I'm a psychiatrist by training. I've been in practice for 26 years. For 12 years prior to learning functional medicine, I ran a clinical trials research center. I was the principal investigator on over 100 different clinical trials with all types of medications for psychiatric disorders and for Alzheimer's. And stay close to this microphone. And so with each new study, a new mechanism of action, I would get excited and hopeful. This drug is going to help my patients that are suffering. But what happened was I just came to see that patients were not getting well. So in traditional medicine and mental health and psychiatry, we can relieve some suffering and we can give some symptom relief, but the notion of really getting well just wasn't happening. So from my own illness and my own healing path, I really finally came to the conclusion that the answer to resolving chronic disease was not going to be found in a pill. So when I turned 51, I became demented. And not in the metaphorical sense of the word, but literally demented. I was losing my memory and I was losing my mind. As part of my clinical trials work, I had done 20 long-term Alzheimer's trials. And while I was doing some of these trials, I came to see that I was as cognitively impaired as my patients. I had developed chemical sensitivity and I became allergic to everything. I was covered with itchy rashes and hives, and I was up all night putting on lotions and steroids. And I had severe chronic fatigue. I literally couldn't get out of a chair for a year. I would break out in hives if I walked into a grocery store, just the smells. I was so sensitive to things. But the worst part of all that inflammation that was ravaging my body was it was eating up my brain. So I would do cognitive testing with my Alzheimer's patients, and I would do the many-mental status exam, and I would give them 3 words to remember. And I had 2 different sets of words that I would alternate with, and I realized I had to write down the words I was giving my patients because I could not remember the words anymore, and I had used those words for 20 years. Dialing a phone number could be a problem for me. I would get confused, and I would have to start over, sometimes more than once. And it's pretty scary when you can't dial a phone number. I would forget to do things on a computer, things that I previously knew how to do. I would ask my husband over and over to show me things, and he would get annoyed because he'd say, I just showed you that, and I didn't remember that he had shown me. I had trouble with my driving and my visual spatial skills. I lost the ability to back up my car and parallel park. Just couldn't do it. My brain just couldn't integrate all of the factors that were happening with those complex motor tasks. Once my husband got in the car with me when I was driving, and he said, Callie, what's wrong with you? You're like a little old lady. And I said, I don't know, there's just too many things happening when you're driving. I often couldn't understand what was being said, and I found out that I developed auditory processing problems. I kept going to my ENT and asking for hearing aids, and he'd keep telling me, well, you just have a mild hearing loss, you don't need hearing aids. And one day he looked at me funny and he said, you know, it's not in your ear, it's in your brain. So I had basically lost the ability to decode words whenever there was any background noises. So I'm 51 years old at that time. My brain is degenerating rapidly. I'm allergic to everything. And all the traditional medicine could offer me was to take steroids to suppress my overactive immune system. I had treated enough patients with Alzheimer's at that point that I knew when people developed dementia in their early 50s, it went really quickly. So if I had not learned about food as medicine and functional medicine, I really would have been drooling nursing home a long time ago. And trust me, I had to learn every facet of functional medicine in order to reverse what was happening with me. So when I came to learn functional medicine, basically I know some of you are practitioners and some of you are new to this, but it's a new paradigm that I call the real medicine. This is medicine that helps people to really get well. So I've been able to adapt it to working with psychiatric illnesses and dementias instead of just using medications as a Band-Aid. It's been just an amazing journey to help patients get off of psychiatric medicines that they've taken for years, sometimes for decades, and see them get well instead of just getting by. So one of my first functional medicine patients after myself was my baby sister. She was 45 years old at the time, and she had been on lithium since she was 20 years old for bipolar disorder. So we started a functional medicine approach, and we gradually corrected all of the underlying imbalances and factors that were a contributor to her illness. And now she's been off her medicines more than 5 years. But the real success is not just that she's off of medicines, it's that she's really, truly happy. She told me on lithium, she didn't get manic, but she didn't feel joy. She said, every day I came home from work and I laid on the couch. I had enough energy to get through the day, but that was it. I laid on the couch, my husband cooked dinner, my husband did the homework with our daughter, and I laid on the couch. Well, she was the perfect patient. She was motivated and she put her heart into following a functional program because, as all of you know that are practitioners, it takes some effort to follow a functional program. But for her, a week after she threw out the processed foods and she started on a whole foods, gluten-free, dairy-free diet and a few basic nutrients, she had so much energy that she joined a gym and she started taking horseback riding lessons. And it wasn't manic energy, it was just real energy. She wasn't noticeably overweight, but by the second month on the program, she told me she was down to her 20-year-old weight and she was feeling super fit. All of her friends and her coworkers and even her primary care doctor wanted to know what she was doing because they all wanted to do it too. So I worked with her for a year before I finally let her start tapering down on her lithium, got everything in balance. But fast forward 5 years later, and she's doing fantastically. So today I told her I was going to mention her in this talk, and this is what she told me. I am way better, in capital letters. I got a whole new lease on life and such incredible brain function with increased memory. I've been remembering names and events from my childhood, and I'm stable for the first time in my life with 5 exclamation marks. And this is some of the stories that I've seen over and over in my psychiatric patients. It's just been such a joy to work with people and restore things into balance for them. Now, I'm not going to tell you that I have all my patients with schizophrenia and bipolar off of medications at this point. Some of them are still works in progress. But when we work with the root causes of their inflammation, when we address the diet and the nutrients, when we address the toxins and hormones, and sometimes the infections that affect the brain, which are turning out to be a really big factor, like Lyme disease, viruses, mycotoxins from mold, that's helped me to really improve people's quality of life, and at the very least to lower or even stop their medicines. So I wanted to close by just saying a few words about the new area that I'm working with, which is reversing mild cognitive impairment and early Alzheimer's dementia. I have had the good fortune to work with Dale Bredesen, and we've been designing a prospective clinical trial that hopefully is going to be starting soon. It's been a long haul. I'm working on a new book about how to operationalize a functional medicine approach to dementia. It's called Dementia Demystified. And hopefully that will be out in a few months. But really what I want people to know about Alzheimer's is that it is a neurodegenerative disorder, but it's not a mysterious, untreatable brain disorder. It's a reversible multi-system illness, and it occurs because of toxins and infections and lack of hormones, as well as the diet and lifestyle factors that we all know about. It also has a strong autoimmune component. So neurodegeneration and dementia, just like psychiatric illnesses, don't just happen. they happen for reasons. And so when we can look at the big picture and address all of those driving factors, then we can get traction in both stopping and reversing the degenerative process or the illness. Then once we can improve and rebalance the underlying causes of the neurodegeneration, then we can call upon neuroplasticity, the amazing mechanism that our brains have to restore themselves. But that's another story for another time. I only had a few minutes, and it's interesting, I had written a whole section about trauma and had to throw it out in the sake of time, so I'm glad we had that talk from Dr. Rankin, because I do think trauma is a really important root cause of illness, and it drives so many things. Anyway, I think I'm out of time, but thanks so much for coming out and supporting